what are the key symptoms of a heart attack and when you should go to the emergency room?
Well, the most common symptom that we all talk about is that crushing chest pain, that sense of the elephant sitting on my chest that's frequently accompanied by shortness of breath and fatigue and sweating, profusely sweating. But the key that I usually give patients is to tell them if it's really something a little bit different than what you normally experience. So for instance, I had a patient in the emergency department, probably a woman in her 50s, not too different than the patient we saw in the last vignette, that came in because she was having back pain, and that was her only complaint. And I was really very proud of our nurses in the emergency department because they knew that back pain was one of those symptoms that could be a sign of a heart attack. And they did an EKG right away, brought us the EKG, and it was clear she was having a heart attack. And when I talked to this lady and she said, well, I've been having back pain for the last 6 months. Are you telling me I've been having a heart attack for the last 6 months? And I said, but you haven't been in my emergency room for the last 6 months. So something was a little bit different today.
And women had historically been misdiagnosed with heart attacks.
Actually, we have heart attacks at exactly the same rate as men have heart attacks. It's the #1 killer of women, as it is the #1 killer of men. Women are more likely to die of their first heart attack than a man.
Because they don't get treatment.
I think that's probably true, that because they don't get treatment as early, and that a lot of the time their symptoms are not recognized. And so over the last 10, 15 years, there's been a campaign to educate not just women, but physicians and other caregivers that it is a significant problem for women, so that when we come in and we complain about chest pain, it is taken seriously, that heart attack is certainly one of the possibilities.